Let's talk about helpful strategies you can use when someone you know may need help. We'll look at two things: acting quickly and remaining calm. Here we go. Family and friends are often the first ones to notice changes in the person they care for. If you think something is wrong, act right away. Here are some signs to watch for. They suddenly no longer have interest in hobbies they used to love, and they start to withdraw from family and friends. They seem to feel angry or sad for little or no reason. They've told you about or seem to be hearing strange voices or having unsettling thoughts. They used to be feeling well, but now they are always saying they feel sick. They seem to be anxious or terrified about situations or objects in life all of a sudden. They eat a lot more or less than they used to, showing signs of restricting. They are more secretive, have started stealing from people around them, and are engaging in risky behavior. Changes you are seeing in the person you care for may be upsetting, but don't be afraid to reach out for help as soon as possible. Learn the signs and symptoms of different mental illnesses and/or addictions to help you better understand what may be going on. When you've identified one or more signs, it's time to act. That can start by talking to a professional. Encourage the person to seek help, but remember the importance of staying calm. Seeking help may be difficult if the person is in crisis, or if they refuse your help. If they are willing to seek out help, here are some tips. Offer to call their doctor or go with them to see the doctor. If the person you're caring for wants to do this on their own, show support by asking what you can do to help. Work together to write down notes or questions either of you may have in advance. The family doctor will examine them and may refer them to specialty mental health care. If the family doctor is not taking your concerns seriously, continue to assert your concerns. Ask for a referral to a specialist or go to a different healthcare provider for a second opinion. Remember, the longer you and/or the family doctor wait, the longer the delay in diagnosis, which may lead to a crisis. Now, unfortunately, you can't always prevent a crisis from happening. If you think the person who needs help is in danger of harming themselves or others, then they are in crisis. Encourage the person you care for to go to the nearest emergency department. Ask how you can support them and if they will give you permission to go with them. If they refuse help but are clearly in crisis, you will need to call 911 so that they may receive help under the Mental Health Act. When you call 911, it's important to be composed and prepared. Make sure you include any information on their mental health and/or addiction history, such as a diagnosis, any current medication, and allergies. Explain that your family member or friend is having a mental health crisis. Explain any physical symptoms they may be experiencing, like chest pain. They might also be experiencing an overdose or withdrawal symptoms. Request a mental health nurse if it's a mental health crisis. Not all police units will have capacity for a mental health nurse, but some do. When the police arrive, remain calm and repeat all the information you provided on the phone to the officer on the call. You have the right to request any officer on scene for their name and badge number to follow up with any inquiries. It is likely that your family member or friend will be put in the back of a police car with handcuffs on, even though they are not a criminal but are very ill. This will be upsetting and traumatic for both of you, so it's best to be aware and mentally prepare yourself. Remember, act quickly and decisively, and stay calm as you go through what may be a tough process. We have lots more information about mental health, addictions, and caregivers on our website.